Just making sure that all my platform has been on. Yep, all good in here. Right. Our topic today is PCOS treatment, which is polycystic ovaries treatment at home. So what can you do at home for PCOS? Okay, what can you do at home for PCOS? Now, if you're patient, I'll share with you something that you can do at home for PCOS. If you're a practitioner, this is something that you can share with your patient to get your patient to do this for at home, all right? Apart from acupuncture treatment, Chinese medicine treatment, and for diet, exercise, there are other things that you can do, which is acupressure point and moxie brushing. Hi, Veronica. Thank you for being here and supporting me. Hi, Eric. Thank you. Okay, if you're up in this live video, please say hi to me and give me a thumbs up, and as well as share this live video, please. Share. Share if you're on Facebook and Instagram. If you're on YouTube, please take the link and share on the social media after this. Okay, let's talk about. So what acupressure point is good for PCOS? Now, you can get your patient to press the point that we show you yesterday, right? But it doesn't make sense for patient to do that. Why is that? Because those points are converting from the gua, meridian conversion from the gua, and you have to press 2 points at the same time to get the meaning out of it, to get the best results, right? In one meridian, which is not practical for acupressure point. Does it make sense to you? So you really have to needle 2 needles on once at the same time to be able to get this result. So therefore we won't use that. We won't suggest patients do that at home. So that is just for acupuncture. Really, that's just for acupuncture. You stick needle in there and it works well, right? It's not for acupressure. It doesn't make sense for you to get that for acupressure point. Just making sure that charging it. All right. Now, right, let me show you some acupressure point first. The point over here, right, which is large intestine 4, but it goes down here called lingu. Okay, lingu. Now, you can do large intestine 4, you can do lingu. I normally get my patient to do it here, go down in here, right? So press, get the most sensitive one, or if there's any other sensitive, like for me, I feel a bit more sensitive in here, so I do it in here, and I keep going, keep going. Funny, I don't have much in here at all. Normally you get a lot of sensitive point in the inner. Okay, I have a little bit in here, right? So this is the point that you should do it. Let's go for here, lower abdominal pain or anything in here, right? Large intestine 4 and below large intestine 4. This is the great point for it. So rub it for 1 or 2 minutes. Okay, 1 or 2 minutes. Really, you want to treat PCOS, you want to rub it for at least 1 minute. Okay, not just 1 or 2 seconds, right? Don't do that. 1 or 2 minutes, right? First point. Second point. Now you want to balance the hormones, right? So we're going to use 3-2-1 acupressure point program that we set up in our clinic. The second one is in here, PC6. So 3 fingers in here. So on this level, on the side, middle, on the other side, which is the pinky side, thumb side, and in the middle, and get the sensitive point and work on it. Again, this is 3 finger and this level, and you can do another level on top here and lower level in here, so it becomes 9 gong, 9 9 gong, 内关, which is 9 gong PC6. So those areas, if you can pick up any sensitive point, then work on it for 1 to 2 minutes. Okay, this is PC6. Then the next one is here, stomach, 36. So below this is kneecap, and under the kneecap you have a big tendon, and in the inside and the outside, which is medial side and lateral side, you have a hollow depression. And from the depression, 4 fingers below the lateral one, the outside, we call knee eye, the external knee eye, right? Below that, for 4 fingers down there, then you press on it under here, and there's a shin bone in here. Is 1 finger this distance from the bone around here, you know. Then get the most sensitive one and give it acupressure point for 1 to 2 minutes. For 1 to 2 minutes, which means you have 3 points right now. 1 in here, stomach 36, PC6, and as well as large intestine 4. So those are very important points. As you may realize it again, I show you those points and last sessions of infertility treatment, right? Yes, this is a general point for everyone, right? For everyone, because those 3 points, it can cover all the organs. So treat the organs first. Make sure that the organs, all organs are working. Apart from your acupuncture and Chinese medicine treatment at home, you need to make sure all organs are balanced. When you balance all organs, you know, you're going to balance all the hormone, right? So this is the first thing. Then second, the 3 point is a basic point. It can be for any disease at all. Okay, very useful. Then further on, we're going to add some more points. In this point, then you can do moxibustion on it. Okay, some of the point you can do moxibustion. Not all of them, but I'll mention which point you can use moxibustion. Okay, moxibustion stick. This is a smoke one, and if you light it, it creates a lot of smoke, and it got warm sensation in there. So you put it on top of your acupressure point, and to help. Okay, there's another black one, which is smoke lace, which we use a lot in our clinic. We give it to patient and ask patient to do that at home. Okay, so I prefer the others, but some people like the smell, and this smell actually smell like marijuana, right? I when we do this, our neighbor come over and say, wow, or we did that in clinic, and the outside people go past and they come in, do you guys do weed, something like this, you know? And we said, no, we're doing moxibustion. Since then, I know it actually smell like marijuana. Okay, to some patient told me that. Right. The first point in here is Guan Yuan. Guan Yuan is 5 fingers below your belly button. So 5 finger below belly button. So I don't know the English name of Guan Yuan, but 5 fingers below your belly button. So use this on top of the point. I don't normally get my patient to press this point in here. I always get my patient to do Moxa. So with the Moxa, you put it on top like this, so you like it, and you take it in a certain, so you make it close to the skin. Do not touch the skin because it's too hot, it'll burn you. Never touch the skin. So when you feel, you can do it yourself though. You can get someone to do it for you, or you can do it yourself. Okay. So when you start to feel heat, you can do circle clockwise. Right? When you start to feel heat, if it's too hot for you, you can lift it up a bit more. Okay, or you can go up and down, sideways. I'll just do this. When it's very hot and you go up and down, follow the meridian or go sideways. Keep circle. Does it make sense? Okay, simple, very simple. So when you do Moxa, then I don't suggest you just do it 1 to 2 minutes. At this point, do 5 minutes or 10 minutes. Okay, it's a bit boring. Just do one point at this, at least 5 minutes. If you can do 10 minutes, even better. Okay, 5 minutes. Okay, Guan Yuan point. Now what else can you do? Xue Hai and what do you call it? San Yin Jiao. Okay, Xue Hai, San Yin Jiao, and Yin Ning Quan. You can do Moxa or you can just do acupressure point. Okay, now I'm going to show you how to locate it. So San Yin Jiao, which is spleen 6. Okay, I remember some of the code number of the acupressure point, but I don't remember all of them. San Yin Jiao spleen 6, 4 fingers from the medial ankle bone, 4 fingers above, and right behind the shin bone, right behind the shin bone, and you get the most sensitive point. You hit it, you go around, you get the most sensitive point, and you can draw it. Then you Moxa on top. When you use Moxa, 5 minutes. You can do 1 2 minutes, or you can do 5 minutes. Okay. Then alternative, simple one is get the acupressure point, press it and rub it, press it and rub it, or use your thumb, press and rub it. Does it make sense? Very simple. Press and rub it. When you hit the sensitive point, just press and rub it for 1 to 2 minutes, at least 1 minute. Okay. Then you go up. So there is a bone in here. So you go behind the bone in here, on the top of that, below your knee on the top, there's a depression as well. That's called Yin Ning Quan. Again, you can do Moxa for it. You can do Moxa for it. For how long? For 5 minutes. Or you can do acupressure point, press it and rub it. Press it and rub it. Okay. That is, you can use this one, you can use your thumb. Okay. Then we use Xue Hai. Xue Hai is, in the knee cap here. It's actually triangle kneecap. So there's a level, and in the inside of the ankle, and here, there's an ankle triangle, right? So in this side, in the inside, about 3 or 4 fingers, normally 3 fingers. 3 fingers above, and you find the most sensitive one. When you heat it, moxie brushing for 5 minutes, acupressure for 1 or 2 minutes. Just press and rub it. So simple, isn't it? So 1, 2, 3, 4. There's 4 points that you can do moxie brushing. Okay. The 1 point definitely you use moxie brushing. You don't use. You can do acupressure point, but I don't suggest my patient do. There's no comfort to do that because it's very soft in here. It's not much tenderness spot in here. It's much difficult to do acupressure point. But you can do it. Just press down and up, press down and up, press down and up. You can do that, right? 1, 2, 3. Okay. Another one is 1, 2, 1, 2, 3. 4. Is it level 3, right, or level 4? Must be level 3. Tai Chong, level 2 and 3, and I think it's level, right? Tai Chong is pretty good for PCOS because they're stress related, and Tai Chong is pretty good for. Then you want to do acupressure point. You don't need to do the moxie brushing, right? Acupressure point. So way about the Tai Chong, if this is my toes, big toes, level 3. Thank you. It's actually in the junction, in the end of the first and second bone, metacarpal bone. Okay, in over here, just like lingual in here and Tai Chong in here. Okay, so get the point. It's so sensitive in here. In general, you have a sensitive point in here. Then press it for 1 to 3 minutes. So that cover the stress. Okay, right. That's it. Simple. Some point using moxie brushing. This is just a general point. Okay, so every PCOS patient can do those points, and again, all of the infertility patient can do all this point. Right, pretty similar when you come to acupressure point and moxie brushing. This is the set point that patient can do it at home. All right. So, but when acupuncture, you can needle those points as well if you wanted to. No. If you wanted, you can needle all this point, no problem. But we have more other strategy, and in our clinic, if we're using acupuncture, right? Keep it simple for your patient, right? One at a time. I show my patient one at a time if they come in, or the best is put it in video and show your patient how they can do moxie brushing and acupressure point at home. So make it easy for a patient. They can watch it again and again. If there's any confusion, they should go back to the video, something like that. Okay, and that'll help. All right. That's it for today, and we're gonna talk about fibroid tomorrow. So we finished. This is the last video of PCOS, and tomorrow we're gonna start a new topic, which is fibroid. What is fibroid? And we're gonna talk what is fibroid, what causes fibroid, fibroid treatment, how to diagnose fibroid, and when it comes to fibroid treatment, it can be Western medicine treatment, then Chinese medicine treatment, and again, home program. What can you do at home for fibroid, and what is the risk of fibroid, right? Does it make sense? Right. We're going to start a new topic tomorrow. All right. Stay awesome, and I love you all. I'll see you tomorrow. All right.